Good afternoon, everyone, and thank you for joining us again for our weekly online lunch and learn. First, I want to explain to everyone I am new, not to lunch and learn, but I am new to maneuvering all this software. So please be patient with me, okay? So if I hit the wrong button, if it goes black, just hold your breath, give me a second, and forgive me, okay? So I just want to thank you for supporting us during this time so we can support the caregivers across Arkansas. We had a great virtual walk, we had a great online hope, and we could not do it without your support. So a few other things we have going on October the 10th, we are having a drive-through movie in Malvern. Last week, the Clarksville one was great. It's a great community with great people, and we could not have done it without the students at the University of the Ozarks. They came and really supported us. So on October the 10th, we will be showing Beetlejuice in Malvern. If you want to keep up with what we have going on, don't forget to text ALZARK to 515555, and you can get all of our updates. Also, go to our website, alzark.org, and you can find about all the great things we have going on. We do have a few things lined up for the end of the year. November is Caregiver Month, and that is why we do what we do. So look for those exciting things. Today, I want to bring in our speaker, Dr. Jesse Abeler. And I want to thank you, Dr. Abeler, for taking time out of your busy schedule to come out and share some important resources for caregivers. So you are from the Arkansas Surgical Hospital in Hot Springs, correct?
It is actually the one just in North Little Rock towards Maumelle.
Oh, towards Maumelle, okay. Kind of
Mhm.
familiar with that. So thank you for your times and your talent. So we're going to let Dr. Abeler do what he does best. So we won't take too much of his time. So if you have any questions or comments, please feel free to leave them in the comment part. And we're going to let Dr. Abeler start his presentation. So thank you so much, Dr. Abeler.
Well, it's my pleasure, and I want to say thank you to the Arkansas Alzheimer's Association and to you, Carolyn, for putting this together. I'm excited to talk about this particular topic because my background or my training is in hand and upper extremity surgery, and this is a topic that has kind of maybe some weird thoughts with it. When people think wide awake and surgery, it's usually something that people get maybe nervous of, or I don't know, maybe they have some questions. And so maybe this will drum up some questions and make people feel comfortable with it. But let me start off by saying a little bit about me. I did my undergrad education in San Diego, California. My background is in athletic training. I went to medical school in Denver, Colorado at Rocky Vista University, and that's an osteopathic medical school. My residency was in Oklahoma City, where I did my 5-year orthopedic training. And then I did a 1-year hand and upper extremity fellowship out in Worcester, Massachusetts, which is about 40 miles outside of Boston. And as we get into the topic, I just want to say that very specifically and very clearly that hospitals and clinics are safe to pursue and receive care from both the provider standpoint and the patient standpoint. A lot of our policies now simply reinforce things that we've already been doing. Frequent cleaning, the physical spacing has changed a little bit. We have changed a little bit of how our waiting room works, but we still are able to see any and every patient that needs to come and see us. Hand washing has become a much more intentional thing, although in between every single patient, we've always done this. And so this has just kind of come to the forefront of what people are interested and careful to do. But then from a treatment standpoint, we're still able to provide treatments in the clinic or when necessary in the hospital. And the elective cases and urgent cases are able to proceed. But I'm excited to see any patient that wants to come and see me, and it is safe. So I just want to reinforce this. Getting on to wide awake hand surgery. And like I said, this is something that maybe people are a little, I don't know, lack of a better term, irked out or nervous about. But But I have to compare this to something like a dental procedure. You go into the dentist and they give you an injection of some numbing medicine, and the treatment is able to proceed while the patient is still comfortable. From a surgical procedure, I can still do that, or the surgeon can still do that as well. A local anesthetic is injected into the surgical area. No sedating medications or general anesthetic medications are required for certain procedures. And in some settings, even they don't start an IV line. And so for some patients, that is a very foreign concept, where it is not invasive, where they don't have the rigmarole that goes along with what you'd commonly think of with surgery. And the most shining part about this, I think, is that the patient is able to remain entirely awake during surgery. And again, everything is tailored towards the patient's comfort and preventing anxiety and making sure that they understand everything that's happening. And the technical term, or the correct term that a surgeon would use is WALANT or WALANT. Depends on what part of the country you're in. But that's simply an acronym for wide awake, local anesthesia, no tourniquet. And so there may be some obvious glaring differences, but what makes this different than a regular surgery? In training and in a lot of patients that undergo this, typically there's pre-testing and clearance required when you're undergoing general anesthetic, or when you're going through a typical surgery, what you would expect. A tourniquet is applied for appropriate visualization throughout the procedure. And then at the time of surgery, there's medications that are administered that make you either go to sleep or are safe through the course of the surgery, through the course of the procedure. With wide awake surgery, there is typically the avoidance of preoperative testing, and of course this is facility-based or patient-based. And so this is a conversation that I will have with my patients, or the patient can have with their surgeon about the requirements. There's no need for preoperative fasting, and this is a very important thing for some patients who are they have any sort of issues not eating, like maybe sometimes diabetic patient may have some concerns with that. But then after the surgery, there's no need for recovery from sedation. And that makes it a lot easier to understand your surgery, what was done, and what is to be expected afterwards, or what the recovery is going to require. And so the question, okay, this sounds great. How is this performed? And this is sort of the rundown of kind of a step-by-step process. The patient comes into the hospital, they're checked into pre-op, and then while in pre-op, I will inject medicine into the area that the surgery is going to be performed. Depending on the region of the hand or the wrist that I use, the medication, I may use a little bit of epinephrine that is mixed in with the medication. And what this does is this allows for control of bleeding during the surgery. And so that's the no tourniquet part of this. This is a pharmacologic control. And again, this is a safe step that allows the procedure to go without increased risk. Before the incision, people might be like, okay, well, I can still feel my fingers, or I can still feel my hand. I can still feel you doing things. The specific area where the incision is going to be is tested to make sure that there's appropriate anesthetic response. So you're not able to feel pain. You might feel some movement of your hand, and that's okay. But the patient comfort is what is most important. And of course, if it's painful, that is not the goal. During the procedure, if some of the medicine starts to wear off, of course, we have more that we can use additionally, and again, safely, because we're able to do this pretty much under direct visualization with the patient able to respond, okay, I'm feeling comfortable, there's no issues, and if, of course, if there's no issues, then everybody is happy. And so the question, well, okay, what is it like from the patient standpoint or from the surgeon standpoint? The injection performed in the preoperative area, I will typically mix with a medication called sodium bicarb. And what this does is this lowers the pH of the lidocaine, or the numbing medicine, to make it more comfortable. And again, you'll feel the poke of the needle but the medication injection itself is not typically painful. It may be uncomfortable for a moment, but it goes away very quickly. The patient is brought to the operating room and positioned for surgery, and that part is entirely unchanged. The only difference is that the patient is not sleepy. They're able to help with positioning, make sure that they are comfortable. And a lot of times what I'll do is I'll ask them what kind of music they want to listen to. The surgical area is prepped and draped. And again, this step is unchanged. The patient will feel their hand moving around or their fingers, but they won't feel any pain at the surgical site. The drapes are put on, and this is probably the most important part for what most people think of, because when the surgical drapes go up, that keeps the patient from being able to see the surgical field, and so that takes a lot of the anxiety away. A lot of patients are like, I don't want to see anything related to my surgery. I don't want to see anything shiny metal, or I don't want to see anything red. This makes it so that you are essentially in the same room. You're not feeling any pain. And then again, as the procedure goes on, the patient has picked out the music, or we're listening to something that is comfortable. A lot of times we talk about our pets, and the patient can chime in with this, or they ask questions about the procedure, or if it's early in the morning, simply take a nap. It doesn't really matter what you do. Everybody is comfortable, and the patient is able to ask questions if they want to participate, or they can remain entirely isolated from it. Through the procedure, the patient is able to move their fingers to test certain tendon movements. With some procedures, it is important that the tendon is able to be tested during surgery, and that's one of the important parts in, say, a trigger finger release or sometimes a tendon repair. If the patient can actively move their hand, that does provide a better check on my part as the surgeon. And afterwards, the surgery is over. The patient has no grogginess. You didn't receive any medicine that makes you feel funny or feel tired. You arrive and pack you change into your regular clothes, and then you get to go home. And that is a very fast transition for what some people might think of when they consider surgery. 30 or 40 minutes in recovery, and then they have some chips or some crackers, some ice water. That is not necessary with wide awake surgery. And so this transition from leaving the operating room to walking out the door is, if you've gone through several procedures, much quicker than maybe what you were expecting. So who is a candidate is sort of a tough way to ask this question, but it's more, when do I like to use this? For soft tissue procedures such as carpal tunnel release, trigger finger release, or flexor tendon repair. And then some bone related procedures, usually towards the tips of the fingers. Those are the areas that I can most reliably make the patient feel no pain. They can feel comfortable. They might feel their hand moving around a little bit, but it doesn't hurt. In a situation where the patient maybe has advancing age, there are some concerns with general anesthesia or sedating medicines that can add to some postoperative confusion that can take some time to recover. This is most often seen on an inpatient basis with a larger surgery, and the patient maybe has a longer procedure. But if we can avoid or decrease the risk to the patient, that is something that I really strive for. Patients who have a higher risk or underlying medical conditions, if you don't have to go through any sort of sedation, a lot of times that reduces their risk as well. So even if they're not if they haven't had that many birthdays, but maybe they have some other things that are a medical concern for them. But then in the relatively healthy, young or old patient who doesn't have a lot of help at home, there's no recovery time from sedation or confusion. And so this does allow patients technically to be able to drive themselves from the hospital. Now, of course, it does depend on what procedure you've had and how good of use you have of that operative extremity. But somebody who may not have a lot of help and they need to care for themselves, either with making their own food or caring for themselves at home, their own primary caregiver, this is something that I do enter into a conversation with the patient. And so the potential downsides, or why not do it? And the biggest one is patient anxiety relating to surgery. A lot of times patients think surgery, they want essentially no part of it. And so they just kind of want to be, for lack of a better term, knocked out. and then that takes care of a lot of the worry for them. It's the same procedure from my part. It's the same surgery. It's just they don't want to really know kind of what goes on behind the curtain. Any potential allergy to lidocaine or the injectable medications that we use, this does come up occasionally. It is rare to have a significant lidocaine allergy, but they do exist, and so that's something that would change the conversation or the recommendation that I have for the patient. But as you get closer to the wrist, sometimes those areas are a little bit more difficult to provide really good anesthesia with a local injection. And so working around or in the wrist joint or around some of the bones in the hand, sometimes those can be uncomfortable. And so we'll have a conversation as to how the best way for the patient to proceed. Why do I like it as a surgeon? Number one, it is safe. There are potential downsides to any surgical procedure, but in the overall care of the patient, this does not increase anybody's risk. And it's very easy to coordinate for the patient. The patient is awake, and so I do like the conversation part with the patient during the surgery. And some people talk a lot and some people don't talk much. It does allow the patient to sort of tailor their questions or their care. But then also at the same time of surgery, the explanation of what was going on, what was found at the time of surgery, that can be explained to the patient in a very clear, non-rushed manner, and they're able to fully comprehend because they're not sleepy. But then from a technical standpoint, it does allow improved testing during the course of the surgery to make sure that there is the appropriate response or the appropriate correction of what I was looking for. And with that, I would like to open up to any questions. If people are just simply curious about a particular topic or a certain thing that I mentioned or maybe didn't mention, I'd be happy to explain something further.
Okay, thank you, Dr. Abeler. That was really really insightful. So when I was thinking about wide awake, I was like, I could understand wide awake because I don't want to be put to sleep. But I was like, do I have to see that? So you answered that question. No, I don't have to see anything. So I only had one question at this point. Is this wide awake surgery available for like feet as well?
That is a really good question. That is something that you'd have to discuss with your surgeon. Okay. It is very procedure dependent. Okay. There are certain procedures that can be done under a nerve block, and that essentially functions in a very similar way. Depending on the anesthesia provider and the surgeon, sometimes nerve blocks still do require a little bit of sedation, not general anesthesia. But for certain toe procedures, I would anticipate there's a way. But as you kind of like with the hand, as you get higher into the wrist or the higher into the hand, it does get a little bit more difficult to get a comfortable response. And so nerve blocks are a different option that are, there's something that I like if I'm not able to do simply local anesthesia. I do like nerve blocks to be able to reduce the amount of anesthetic that a patient needs. And this is procedure specific.
Okay. So I did not do this. See, I told everyone I was not good at this. So there's some things I forget. So I do want to thank you for your time and talents. However, can you please give me I'm going to put your contact information across the screen real quick so it'll stay with this video because other people can go back and watch it at their leisure. So do you have a contact information that I can add to the screen? Is a phone number, a website?
The best location to be able to get a hold of me or find my contact information is at arkansassurgicalhospital.com.
Okay, I'll add
and
arkansassurgical.com. One word.
I'm sorry, the specific is ARK surgicalhospital.com.
ARK.
ARK, surgicalhospital.com.
I'm fixing it. I'm trying to fix it. So I am not a typist. Arkansas Surgical Hospital.
Mm-hmm.
.com. I think I have it, and I'm going to add it to the bottom. So if anyone would like to get in contact with you, of course, they can contact us, and we will get them the information and get them connected to you as well. So thank you again for your time and your talents, and we really appreciate you. So thank you, everyone, and just remember we have a drive-in movie coming in up in Melbourne on October the 10th at 7:30. So it is pay what you can. We are looking for sponsors. So and November is Caregiver Month, so we have some exciting things coming up to help support caregivers across Arkansas. So thank you, Dr. Abeler, and you have a good day.
Carolyn, if I can, real quick,
Sure.
the website is ARK Surgical Hospital.
AR, oh, like Arkansas. Help me fix it.
And I don't want anybody to get lost trying to find us. We do like to take care of anybody that wants to come see us.
So I'm gonna show it one more. That's the correct.
Perfect. There you go.
Thank you so much.
Beetlejuice is a good pick for October too. That's a good selection.
All right. Thank you so much. Have a good one.
Thank you so much.
Okay. Bye-bye.
Bye.